Okay, so I just wanted to give an update. I've been giving updates on my Instagram so that family and friends know about everything that's going on involving my health. But I just realized that I haven't been keeping up to date on my YouTube for people who may be interested in knowing. For years, I've suffered from vision problems because I have to wear glasses, and I've been wearing glasses since I found out I needed them at 7 years old. So having vision issues was not new to me. I'm used to that. And as I got older, my vision was getting worse and worse, and I thought to myself, well, I mean, their vision gets worse as they get older. That's nothing new, so I didn't think anything of it. And then between the ages of 18 and 21, when I was able to locate my birth mother, and I spoke to her about what health problems run in her side of the family, and she explained to me about what she deals with and everything. And then I started to realize that some of the health problems that I'm dealing with most likely come from her. So I found out that the vision in my eyes, yes, it comes from her. It's not just like a normal having vision problems where your vision is so blurry you just can't see anything because it's so blurry that it's hard to actually make out what you're looking at. My vision got to the point where I was having floaters. And when I say floaters, it first started out just being little dots that would float in and out of my vision. No matter if I looked around the room, they would move around at the same time, and 99% of the time, I'd have to wait for that floater to move out of the way for me to have a perfect view of what it is I'm looking at. But I had been dealing with it since I was 14, 15, so I just figured it was normal. And when I told her about what I was dealing with, she goes, yes, I've dealt with that too, except when she had floaters, the floaters got worse and worse, and eventually it got to the point where it covered the majority of her vision and she couldn't see anything. And when she was my age that I am now, she ended up having to have cataract surgery to remove it. And she did have the surgery, and it made it better because now she's able to see. And she doesn't have to wear glasses 24/7 like I do, but it definitely made it to where her vision was better. And because she told me this, I assumed that I would have to go through the same thing. I'm in my early 30s, the same age that she was when she had to have the surgery. And the floaters were getting stronger. They went from little dots to very large twigs looking like branches from a tree. And it got worse and worse, and it started making it more difficult, mostly in my right eye. And I thought, okay, I may have to go through cataract surgery just like her to improve my vision so I can actually see. And so I spoke to my husband and explained to him about my conversation with my mother and that I'm at the age that she was when she had to have the surgery. And he goes, well, then you may have to do that if it helps with your vision. So he went online and he looked up a specialist who can dilate my eyes and look in there to see if that is what I needed. And so it was on October 1st of this year that I ended up going to see just some type of specialist eye doctor. She put eye drops in my eyes to dilate my pupils, and she had a machine where she looked into the back of my eyes. And my left eye, for the most part, is normal. I don't really have much issue with that. I mean, yeah, my vision is blurry without glasses, but I see a lot better out of my left eye than I do my right. And when she looked at my right eye, that's when she discovered what she believed to be a tear in my retina. That's not a good thing, because if a tear in your retina, which is the thing attached to your eyeball to where you can see, and if the tear completely snaps in half, you will go permanently blind if it does not get fixed. And so she wanted to send me to a different specialist who actually, I guess, had better technology to use to look more into my eye to see what was going on with it and what could be done to fix it. And she, at one point, asked me, do you suffer from migraines? I said, yes, on a near daily basis. Almost every single day I will wake up with just a regular headache, And 99% of the time, I have it all day long. But I got so used to them that I literally thought it was just normal. So I didn't really say anything. And I don't tell people I have headaches. I don't tell people that I have severe pain in my head until the headache has progressed to a severe migraine to where I cannot be in a room where there is light or sound. But I didn't know that the migraines were connected to my vision. And she believed that it was. And I thought, okay, well, that would explain a lot, because if that's what's causing it, then it needs to be dealt with. I hate migraines, but I've been dealing with them for so long that I didn't put two and two together. I just figured, okay, everyone has headaches, everyone has migraines, it's normal. So she sent me to a specialist, and I went to see them Friday, October 15th of this year. They had progressed technology to where they could look inside my eye. They took a lot of pictures, and it didn't help that when I went to go see him that morning, I had woken up with a severe migraine. But I did everything in my power to push through that pain to get that dealt with, because I was hoping that they would find answers. And so after all the pictures were taken and everything, he got quiet. And I'm waiting for him to tell me what he's seeing. And he goes, "You need to see a neurologist." And I said, "Okay." He goes, "I'm going to have your doctor. I'm going to call them to make an appointment. You need to see a neurologist for the migraines. And you need to have an MRI done ASAP." And I'm like, "Why? What's wrong?" And he says that I am suffering from swelling that is pressed against a nerve in the back of my right eye. He showed me the pictures on his computer, and I took pictures of that with my phone so I could show my husband later. And I had him write down all those fancy technical terms involving what was going on with my eye. I brought it home so he could see it. He looked up all of it online, and it was showing me what the internet said and what it means. And basically, the picture shows where the nerve in the back of my right eye, the nerve should be completely flat at the bottom. And it showed in the picture that there was a bump this big on the far right side back here on my right eye that should not have been there. And the first thing out of his mouth is, "I'm hoping it's just possibly fluid trapped back there pressed against the nerve. And if they can, find out through an MRI about relieving the pressure to get rid of your possible migraines. That's what I'm hoping it is." I said, "Okay, what do you think it is?" And he goes, "Well, I'm really hoping it's not a tumor." And I'm thinking, oh, great. I have a tumor. Okay, then. Well, I didn't know what else to say. I was just like, okay, well, if I have a tumor, I have a tumor. There's really not much I can do about that. So I ended up seeing my regular doctor. I told her everything that was going on, why I even went to the eye doctor. And she knows that I suffer from headaches, but I never told her how bad the headaches were, so she never really thought to send me to a neurologist. And I finally told her that I deal with headaches on a complete daily basis at this point, and sometimes they turn into full-blown migraines, and sometimes they're just regular headaches all day long. And most of the time, I wake up with them. And so she scheduled for me to see a neurologist, which was right next door to her. And she also scheduled for an MRI to be done. And I had the MRI done. And it didn't take long. And the results came back showing that I had, what is it called? The MRI results said that I had a vascular abnormality. And I'm like, okay, more fancy words. No idea what that means. The neurologist looked at the results of the MRI. My husband went with me to that appointment and actually sat there with the doctor, and I was able to do my best to explain most of my headaches, what I've been dealing with, and then he was able to fill in the rest for the parts that I didn't understand. And he talked to the doctor too, and I was listening to them. And the neurologist said, "I'm going to prescribe you some migraine medicine. You are to take it at night because I told him I had been suffering from insomnia since 2005. And the migraine medication that he prescribed for me, I had to take it at night because the side effect is drowsiness. And I take it every night, and 99% of the time, I fall asleep almost immediately after taking it. Sometimes it takes 20 to 30 minutes to get in my system. And it does make me drowsy, and it's supposed to prevent migraines from when I first wake up in the morning. And when he looked at the results of my MRI, he said that he wanted me to go through a spinal tap, which is also known as a lumbar puncture. And to explain what that is when you have to lie, you either can lie flat on your stomach, or you can lay on your side, and they numb the area, but they put a needle into your lower spine, and they take fluid from your spine. They run tests on it to find out what... My dog is going crazy with his toy. The fluid will be tested to find out more information as to what's causing the migraines. But he had already told me to begin with that I had macular edema, which is swelling and fluid accumulation in the back of my eye. And the spinal tap is supposed to show if they can maybe just go inside that area with like a tube and drain out the fluid to where it's no longer pressed against the nerve, or if something more extreme needs to be done. And when they found out that it was a vascular abnormality, that right there checked off the box to let me know it's not a tumor, but it does need to be dealt with for the migraines to stop. And also, the spinal tap was supposed to find out if I have Idiopathic Intracranial Hypertension. I'm going to put in the description box with this video all of these fancy words, so if you want to look them up to understand what the heck I'm talking about, you can. Because I had to go and look them up myself just to find out what the heck was going on. They're very big technical terms for everything that's wrong with me. And today ended up being the day that I had spinal tap. And the nurse and the doctor, step by step, explained to me what was going to happen and how it was going to work. And they told me specifically that after the procedure was done, I am not allowed to do any bending over or lifting severely heavy stuff until tomorrow morning. That is a no-no. And there are some patients who have experienced a side effect from a spinal tap, and most of the time it's just a really bad headache. And I told her, I said, well, I deal with headaches on a daily basis, so it probably won't be any different. But if it is, what painkillers am I allowed to take if the headache is so severe that I'm crying? And she said, you can take Tylenol. Tylenol will help with the headache and the soreness that you're going to experience. Now, when the spinal tap is over, the only thing I was experiencing for the first 3 hours afterwards was just sensitivity where the injection site was. It was just really sensitive to touch, but I didn't feel any pain. It wasn't until around 3:30 to 4 o'clock in the afternoon that I started to feel soreness in my back, but not on the injection site. It was on the sides of it. And the pain slowly progressed to the point where it literally felt like the muscles in my back had been pulled, as if I had lifted something too heavy that I shouldn't have, causing my back to be so sore. And I told my husband, I've gone from just feeling sensitive in that area to now my back feels like I pulled something. And it was starting to feel more and more like a lot of discomfort. And most of the time, I just lay down on the sofa or I lay down on the bed. Or I've been sitting on the sofa when I eat. But they made it very clear, bending over, do not do. So I like the fact that I know how to pick things up with my feet. So that helped a lot today. Whenever I would drop something, I could pick it up with my feet and then lift my leg up to put it in my hand. So I wouldn't have to bend over at all. That helped. At one point, I tried walking my dog when I came home today, but he has been in a weird mood today. He's just so hyper and just acting crazy and stubborn. And my husband goes, you don't need to be walking him. He's going to jerk you around all over the place, and you are not allowed to have that. You're not supposed to bend over. And he might cause that. So he took over the leash and started finishing walking him so I can go check the mail. Now, I can check the mail without having to bend over. But I started to feel some more discomfort, and that's when he went and found a bottle of Tylenol in the house and gave me some. Normally, Tylenol doesn't help, and it doesn't work for me, but this time it actually did. It relieved the pressure and the discomfort to where I didn't feel so stiff. But he told me that he felt like I was a very brave person for going through with the spinal tap, because everything that he's researched to him sounded scary. And I'm like, well, I've never had it done before. And I did ask probably 1,000,001 questions to the nurse. It felt like it. I asked her a lot of questions. And when I told my sister 2 days ago about the fact that I was going to have it done today, the first thing out of her mouth is, oh, so basically it's like an epidural. And I looked at her and I'm like, who? And my husband goes, yes, tell her yes, that's what it means. And I'm like, what the heck is an epidural? And my sister goes, sometimes women have those when they're in labor. It helps with pain. And I'm like, oh, okay. I didn't know that. Never been pregnant, never had to deal with that. So when she told me that, I'm like, what the heck is that? Turns out that's pretty much what it is. I told her about what was going to happen, and she goes, okay. She goes, well, hopefully they'll find out what is going on, and they could put an end to it. I did ask the nurse if there's a 50-50 chance that the spinal tap will leave me paralyzed, because it was a concern that my husband had. I wasn't even thinking about that, but he was. And the nurse goes, no, I don't know of any patients who have had a spinal tap and ended up paralyzed. You shouldn't have that problem. The only thing you're going to deal with is possibly a headache, and you're going to have a lot of soreness in the area where the needle went in. Now, when I had the spinal tap, they first had me lay flat on my stomach, and they put some kind of orange stuff on my back where the incision site is, and according to them, it's to disinfect all of the skin around it to make sure that there is nothing there that shouldn't be. It's to completely clean the skin before the needle goes in. And then once they cleaned it with some orange stuff, I will try to later do a little slideshow on a video to show you how everything looked. But then they slowly put a needle into my back. I felt a little bit of a sting, and the sting was the needle going a little bit into my skin just so they can numb it with a solution. They numbed it, and once it was completely numb in that area, they slowly put a very, very skinny needle into the area of my spine, and then they put a really tiny tube inside. They slowly checked it first, and apparently they were looking for pressure, and if the pressure was too high, they would have to go deeper into the spine. But the pressure showed normal, so they didn't have to go any further in, and they told me they needed 4 vials of spinal fluid, and the 4 vials make up either about 2 teaspoons, or if you look at a measuring cup that comes with the liquid Benadryl bottle, it will say 10 mLs, and that's about how much liquid they need. And my first thought was, well, if it's going to drip out and you need about 10 mLs, it's probably going to take 30 minutes to do that. And she goes, no, normally it only takes about 5 to 10. And I'm like, because in my mind, I'm like doing math in my head. I'm like, that doesn't sound right, but okay. And it didn't take that long at all. It didn't. Once they got the needle and everything into my spine, they slowly had me move from my stomach to where I was laying on my side and facing the wall. And I believed that he was trying to get my mind off of the fact that there was a needle in my spine at that moment. So he started telling me a story about what happened to him and his dog over the weekend. It didn't quite make a whole lot of sense, but he was telling me the story about it. And I was trying to concentrate on that and also concentrating on just breathing normally. But once it was all done and over with, they pulled the needle and the tube out, put a Band-Aid over it, and then the nurse helped me slowly get up into a sitting position to where I could slowly get off of the medical table. And she goes, "You did really good." She goes, "Do you have any questions?" And I'm like, "No. Not really." I'm like, "I'm just thinking about wanting to eat because before the procedure, they told me I can't eat a whole lot of food, just to eat a small, light meal." So I only had like half a bagel this morning before going. So when the Spinal Tap was finally over, the first thing I was thinking about was food. So my husband took me to Arby's because I really like Arby's and I don't get to eat it much because they're pricey. But I ended up having that for lunch, and as I was slowly getting my shoes back on and my jacket back on, I happened to glance over and she was putting a label over each vial that shows my information so people in the labs would know that it's my vials. And I looked at the vial and I'm like, "That's the fluid from my spine?" She goes, "Yes." And I'm like, "It looks like water." And she goes, "Yes. Yes, it does." And I'm like, "Is it supposed to?" She goes, "Yes, it's supposed to look like this. It's completely clear, and that's a good thing." And I'm like, "It just looks like you put water in the vial." So, and then she asked me how I was feeling to make sure that I wasn't experiencing anything. And I'm like, "No, my back feels a little bit stiff from having to stay laying on my side for so long. I felt stiffness, but for the most part, I was okay." But she kept telling me the whole time as she walked me out to the lobby, "Do not bend over. Do not," I mean, she said it so many times, that's all I could think about the whole ride home, other than food, was her telling me bending over is not an option. And, because I told her that I was planning after the Spinal Tap to do some chores when I got home. She goes, "No. You need to rest, relax, maybe even take a nap. I mean, just don't do anything that involves having to bend over." And I'm like, "Okay." I said, "When am I allowed to start bending over?" She goes, "Tomorrow morning around noonish. Then you're allowed to start bending over because the effects of it should be worn off and you should be okay." And I'm like, "Okay." So, I mean, it's almost like she couldn't stress it enough. Bending over, not an option. So, but anyway, I had to have all of this done just to find out what is going on inside of my brain behind my right eye. Hopefully, we will finally get the results and find out what on earth is wrong with me. So, and she told me it usually takes about 5 to 7 days to get the results back, and he's supposed to call me, the neurologist. And I said, okay. So, that'll be fun. Now, tomorrow, my puppy will be getting fixed. I was able to schedule it a couple of weeks ago, and he is 8 months old. And he definitely needs to be neutered because he won't stop humping everything. I saw him trying to hump a cat, and I had to pull him off the cat. I saw him trying to hump a toy, and I'm like, it's a good thing you're getting fixed, dude. You have got to stop. But, yeah, I'm hoping once he gets fixed, all of the aggression in him and wanting to wrestle so much will just calm down. So, anyways, that's pretty much my health. So, again, in the description box, I will try to put the list of everything that's been going on. So, that's it.